Good morning, everybody. It's a great honor to be here, and great thanks and appreciation to Her Royal Highness, the Mother of the UAE, Sheikh Fatma bint Mubarak, for her vision, for her leadership, and for her courage. Also, we are very appreciative for His Royal Highness Diab bin Mohammed bin Zayed. Our session today really cannot beat Ahmed Hilmi and the children, but we are very grateful for them because they have set the stage. It's a great honor for me to moderate a very valuable intervention by key stakeholders who are providing or ensuring the right to mental health. I would like to start with His Excellency Mr. Maqsood Cruz, رئيس الهيئة الوطنية لحقوق الإنسان. Thank you for your vision, because when we were setting the agenda, you came up with the title for this session, Together to Ensure the Right to Mental Health. And we have identified 3 institutions: the state, the community, and the family. Why? Why these 3 institutions?
Thank you very much, Your Excellency, and it's a great honor to be amongst this wonderful panel with distinguished speakers. Basically, there are 3 P's I want to remind all of us about: the component of prevention, the component of promotion, and the component of protection when it comes to the right of mental health, and what does it mean in this regard. Also, we need to have a holistic approach. So obviously there's a role for the state, there's a role for the family, but also there's a role for the entire system, the entire community, how we can work together to advance and enhance our understanding of the right to mental health. And mental health as a subject, when it comes to the human rights component of it, we look at it from a different perspective through a spectrum that rises from work itself and what it means to be healthy, but also within the family, within the society, and how we can work on this from being children all the way when we are adults. And frankly, when it comes to mental health, we always say there is no health without mental health, and we need to be able to move forward in this regard.
Thank you. And I move now for Dr. Shayesta. As a CEO of an integrated healthcare company, we would like to hear your vision of mental health in the MENA region. That's the Middle East and North Africa, our part of the world.
Thank you for that. Assalamu alaikum, everyone. And first of all, I would want to express my heartfelt gratitude to Her Highness, Mother of our nation, Sheikh Fatma bint Mubarak, for the overwhelming support that she's shown for all of us. And I know that I'm sitting here because of all her support. And of course, my dear friend, Reem, for the amazing work that you're doing with Healthcare Partner together to make mental health accessible, affordable, and to make it known for everyone. So when we talk about what my or our organization's vision is for mental health, I think it's important to consider where mental health is today, because we can determine what the vision should be by identifying the problems right now. And the best way to do that is to give you an analogy, which I just came up with while discussing it with my very good friend here, Dr. Maqsood, is that if you have a machine has a hardware and a software. So the human body is just like a machine, hardware and software. And the problem with that is that everybody's focused on the hardware. Nobody's looking at the software. So what happens when your iPhone, your software in your iPhone or your Samsung phone collapses? Your phone shuts down if you don't get a reboot, if you don't get the right care of the software, but nobody's looking at it. So currently, mental health is, or the care that's being given to mental health is below par. So the immediate future, the vision is to bring it to par. And in the midterm to long-term care future, the basic problem in mental health is awareness, accessibility, and affordability. These are the 3 basic issues that we're facing right now, where it is not democratized. People don't have access to it. It's considered a privilege. So what we're wanting to do is change that dynamic to ensure that mental health is accessible, affordable, and it's communicated properly. And the only way to do that is through technology. So with us, with Sakina, the vertical that we launched, which is dedicated only to this topic, and we have some of the members here, some of the heroes that are working on this cause in UAE and beyond, to ensure that every single human being on this planet, his fundamental right, like food, shelter, security, gets access to mental health. Thank you.
Well, I would like to echo thanks and appreciation for Her Excellency Reem Al Falasi for the preparation and the vision behind this great conference. Thank you very much for all your input. And I really would like to carry on what you've said and say, how do you ensure that it is patient-centered? Or let me push it a bit more and say child-centered and adolescent or young children-centered, because this is the most vulnerable group, and this is where we have to invest, and this is where the investment has the highest return. How to make it child-centered and how to make it affordable.
So how to make it affordable, I will tackle this part and then we'll revert to the child-centered, is just through technology. Now imagine if every human being, all of us, everyone in this hall, if you had a dedicated physical trainer, a GP, a mental health coach, a nutritionist with you 24/7, do you think your lives would be better? For sure, they would be much better. But unfortunately, due to the dynamics of healthcare, where it is not that accessible in the world, actually 50% of the global population does not have access to healthcare immediately. They don't. That's a huge issue. The only way to do that is to make it available to every single human being through technology. I mean, we're going towards an era of the 4IR, the fourth industrial revolution. Healthcare is way behind, and we're trying to change that dynamic. We launched a super app, Pura. We've got about 550,000 users on it just from last year who are benefiting from 360-degree healthcare, where the AI life coach is with you 24/7. It ingests your data. It gives you the right guidance. It monitors you. Say, for example, it will say, "Doctor, you didn't sleep well last night. Should we give you some meditation courses?" Or, "Doctor, we feel that you are going through a lot of stress and a lot of pressures, or your blood works are off, or this is off. Should we connect you to the right psychologist or a mental health coach?" Imagine if every single individual, whoever has a smartphone, has access to that.
And how to protect against cyberbullying or cyber violence.
So of course, as in all applications that are available out there, this one is also closely regulated. It has to be. And of course, with all kinds of AI out there, there is a check and balance. There is no way that you can just unleash something out of control. It's good that you mentioned cyberbullying and digital exposure. Within Sakina, we have a dedicated vertical that focuses only on digital, I won't say addiction, dependency. Digital dependency on children. And it focuses on how to wean them off of that screen time. So there's an entire component there that would recognize, even if there is that kind of a digital dependence or if there's that kind of a cyberbullying. The other thing is that with Pura, it is not an open platform where every individual is coming in and speaking to each other. So there is no account of cyberbullying happen from one individual to another. Pura is a communication which is happening from healthcare professionals, from a trained system to individuals. Okay. And on your other question on the child, I think it's very true that it takes a village to raise a child, right? So for a child, even before a child comes into the world, his entire coming into the world is dependent on the mother's mental health. Is she in the right mind? Is she eating properly? Is she giving the right focus to herself? The environment that she's in. And as soon as a child is born, we know the first 5 years of a child are
very
formative.
crucial. Yeah.
So the focus on the entire environment to make sure that that child prospers into a healthy, into a happy adult.
Okay, let me now move to a very important entity, the Committee on the Rights of the Child, the UN Committee on the Rights of the Child. And we're very honored to have the Vice Chair of the Committee on the Rights of the Child. Tell us, how is mental health being treated by the CRC And let me tell you that raising the banner with the right to mental health is a revolution in our part of the world, because there is always some apprehension from the notion of human rights. So I'm really honored to be in this with the pioneering Emirati perception of children as right holders. What can you say?
Thank you very much. Honorable speakers, excellencies, ladies and gentlemen, it's an honor, a pleasure for me to be here on this panel. And I'd like to join the thanks to Her Highness Sheikh Mubarak and all the organizers who have organized this wonderful event. And I would like to commend the Supreme Council for Motherhood and Childhood, first of all, that they began this wonderful event with children, because it's very important that we talk about children. We talk about their mental health with them and not excluding them from this, because they know best what they need. They know best what are the challenges. So it's very important, and I would like to highlight this. Regarding your question, the Committee on the Rights of the Child, as you might be aware, it's the monitoring body which is based on the Convention on the Rights of the Child and unifying 196 countries. It is the world
country. Every single country on the globe has ratified the Convention on the Rights
except of one,
which is
the United States.
No, they did. It's global now, so it's obligatory for every country.
Yeah, it's obligatory for every country, and it's the mostly signed human rights treaty of the world. This is very important, but mental health is in the focus of the committee, because it affects the realization of many other rights of the child. What we do in the committee, we address the recommendations which are specified to concrete country. And to come to the points you have raised, Madam Moderator, it's an important issue and also sometimes controversial one, because how we can balance, on the one hand, the convention says the committee and the convention needs to respect the culture of each and every nation. This is something very important and needs to be addressed. But sometimes it is also subjective. So how we balance that? And inside the committee, we have very often different points of views, because we all come from different regions of the world. In my part of the world, we are a very traditional society. I come from Georgia, but there are some others who have different views on that. So how we balance? For me personally, it's very important to respect the culture of each nation, the traditions of each nation, till it does not violate the red lines. So this is difficult, but this is manageable as well. So the last years, what we have seen and witnessed in the committee, more and more countries complain about the increase of mental health challenges with children, especially COVID-19. Post-COVID period, it has shown that it's huge increase with children's mental health issues, but other components are coming.
And also armed conflicts everywhere in the world.
Armed conflicts.
And television transmitting these armed conflicts.
It affects children hugely, but also gambling, also substance abuse. Drugs, etc., but also the digital addiction, as it was mentioned by previous speakers. It is something what we need to address, and in the committee we try to address for each specific country separately.
أنا حابة أقول حاجة بالعربي، إن اتفاقية حقوق الطفل زي أي اتفاقية حقوق إنسان لا تتدخل في الثقافة الوطنية والمحلية، وأن أي دولة تصدق على الاتفاقية تنفذ هذه الاتفاقية بما يتفق وثقافتها المحلية وعاداتها وتقاليدها، فلا يوجد أي تدخل في الثقافة الوطنية والمحلية. I would like to move to a very successful, to my view, I believe that the UNICEF is one of the most successful UN agencies, really. How do you you are in charge of special protection.
That's correct.
How you see special protection in terms of mental health? What's the policy of UNICEF? How do you deal with it?
Thanks a lot, Excellency. Let me start by saying how impressed I was to see the children at the beginning of this event. I think they said it all. Their common sense, their good heart. So I cannot be more impressed than, those children who tell us the truth, their experiences, and congratulations to the Supreme Council for Motherhood and Childhood to keep this thought leadership on mental health. Now, trying to answer to your question, I will have to deviate a little bit, but I will come to the answer. When I started practicing long time ago as an intern on clinical psychology, I remember I saw two things. I saw families and children who have undergone severe stress, and despite that trauma, that distress, they would be able to cope with the difficulties. For me, it was a mystery. Why? And also, I saw families and children who, for many years, mothers, after 30, 40 years, their own experience of childhood would have been extremely traumatizing, and they could not really come back. Why that? When we approach childhood from a policy perspective and in UNICEF, we always say what happened in childhood didn't stay in childhood.
Yes.
We bring deep inside us all those powerful experiences of childhood that could be our protective factor, but that can also turn against ourselves. This is our experience. Now, from a policy perspective on what can be done for children, a few important things. The first thing that we need to demystify is that no country in this world has enough specialized
Yes.
mental health care. I do not see one single
Yes.
country.
Yes, and we're coming to that. Yeah.
Now, what can we do instead? Mental health is built in positive relationships in childhood.
Positive parenting.
From parenting, the initial relationship with parents, how you deal with your teachers, your peers, your friends, and so on. In this journey of the child, what is the most powerful preventive mechanism is to ensure that public services would be the early childhood services, school, throughout that journey of the child, everybody interacting with children is equipped to prevent mental health disorders, illness, distress, and suffering. However, one of the difficulties is that we are not capitalizing on this wonderful workforce. Look at the child, interacts with a pediatrician, general practitioner. We should equip all this workforce to be able to support families and children better. Same for teachers. However, careful, this is not to provide highly specialized medical care. This is prevention. What can be done at that point? So that's the most powerful thing we do, is investing in a workforce that can accompany the child and be accessible to the children. That's the most powerful. Parenting, for sure, is demonstrated that it's one of the most effective ways of promoting the well-being and the mental health of a child at any time. I always said that before becoming a father, I read hundreds of books on parenting. When I had my own children, I was completely lost. Why? Because when it's our own blood, our own children, we become vulnerable. And for governments and organizations like UNICEF, it's critical that instead of pointing fingers at parents and telling them what to do, that we accompany them in this journey and help them to find their own solutions. There is no more time for heavy lecturing. I think it's more that engagement, listening, as you were listening this morning to children.
How do you ensure that no child is left behind? In the MENA region, there are many vulnerable children. How do you ensure that no child is left behind?
Well, a few alternatives. There are several scenarios in the MENA region. The first and the most worrying at the moment is the high impact of armed conflict in our region. Children are suffering. But there are amazing people, frontline workers who didn't have a PhD or a medical degree, who are capable of helping children on a day-to-day basis. We see that in Gaza, we see that in Lebanon. Maybe it's not enough given the magnitude of the horrors we're seeing, but this is possible, supporting those frontline workers. Maybe not the specialized psychiatrists, psychologists, medical doctors, but people who are close to children. Again, parents, enhancing the capacity of parents. In terms of the children left behind, probably the most serious challenge we have in MENA region would be a few categories of children.
Poverty?
Poverty, but also children with disabilities, which remain invisible to many of us. Children living in residential care in many countries as well.
Yes.
It's a difficulty.
Yes.
Yeah.
Children في دور الرعاية. دور الرعاية is some sort of deprivation of liberty. The best place for children is to be with their family.
Correct.
Yeah. But I'll ask you a question. Maybe it's not fair, but I have to put it to you anyway. Is there coordination within the UN system between the agencies? Let's say for children, in order to make it easy for you.
I would say that in terms of our global policies and frameworks, yes, there is a common vision. But I think it's important for UN agencies, and please, my colleague will tell us more, never a UN agency can replace governments. Never. So I think what makes the difference is when UN agencies, we manage to really come together with governments as the entity responsible for the rights of children. There are difficulties on the ground, but I think we are making progress. And with WHO, we have been working
Do
extensively
you
on
find
mental
it
health.
sometimes difficult to convince governments with new ideas,
Yes.
like
but
mental health?
on mental health, let me say, the difficulty we face on mental health is that we need to come with much more practical solutions to offer to governments. Too many times we go to governments and say, oh, you are not investing enough on this, or you don't have enough people here and there. I think the approach should change. We need to also challenge ourselves. I think it's better at this point on time to propose government solutions that are suitable to their country. And I think one of the solutions is that invest a bit less on tertiary care. I'm not saying to drop tertiary care, it's important, but focus the efforts to prevention. And I think if we tell them, you have people, your teachers can be mental health promoters, your parents can be mobilized.
Capacity building of teachers.
Correct.
Of parents.
Correct. So we are not using the full capacity of all those interacting with children wherever they are. So I think that's the game changer here. In addition to digital technologies that were mentioned, that if we are using them wisely, could be a way for governments to reach out those children who are left behind, as you, Excellency, mentioned earlier.
Well, I'll come to a most proud UN agency, the WHO. Without prejudice, the WHO really has done a lot, and we're very proud. The WHO prepared the Mental Health World Report. Not only that, they prepared an action plan. And just before coming here, you told me that you started a new guideline. Please tell us about the World Health Organization.
Thank you. Yes.
And take care or try to answer some of the questions I squeezed your colleague from UNICEF.
I'm actually very thankful to be here, especially I think, UNICEF and WHO sitting at the same table with governments, with other organizations is already kind of a really important step and milestone. We've worked together a lot. We have joint programs actually focusing on mental health of children and adolescents. So there's a lot of collaboration ongoing, but as it was mentioned, the government must take the lead. Yes. We can support. We're technical agencies, we're implementers, we can support, but the government needs to take
يجب أن تقود الحكومات ودور الأمم المتحدة معاونة الدول ولا يمكن أن تقوم بدور الدولة.
Yeah. So we're here to support. We're here with also practical tools. I don't fully agree that we don't have practical tools to give. We can be better, but I think there are a lot of evidence-based interventions that can be made available, that are available actually. We have the technical capacity to support, but there needs to be that political commitment.
And to build the capacity
And to build the capacity as
of
well.
all professionals.
Well, that's the idea, right? So the idea is to invest not on tertiary level, but really to strengthen community services. And that's the only way to scale up. So really investment into those contact points for children, like you were saying. So we're thinking about health workers that are not specialized health workers. We're thinking about parents, but also the schools. So we know that, health sector cannot do it alone. We really need to have this coordination, this integrated approach across sectors with education, with welfare, with justice system to really support the children where they're at and go and reach them where they're at. So really integration into primary care, integration into the community is really the way forward. And then I really also want to commend, I know we all said it, but really starting with the children.
Yes.
So we started with the children today. We heard what they have to say. And what they had to say was they want to be heard. They want to be involved in the policies. They want to be involved into the design of services so that really they can be tailored to their needs. You were asking, how do you tailor interventions to their needs? You need to involve the children, involve the adolescent and the parents. So the mothers, it's not, interventions should not be focused on childhood only, adolescents, really a life course approach that starts from preconception. So when we think about children, we need to think about the mother first during preconception, and then the whole family system and how to support the parents to support their children.
Thank you very much. And this really concludes our conversation here. Of course, we need more time, but I think the message is clear. Nobody can do it alone. We need to put our hands together, be it as UN agencies, being at different institutions in the society, the state, the family, the school, religious entities, educational entities, hospitals, universities. لابد من تنسيق الأدوار. لا توجد أي جهة تستطيع أن تقوم بدورها بمفردها، ولكن الأهمية هو تمكين الأسرة، الأهمية هو التربية الإيجابية، تدريب الوالدين، رفع الوعي بأن الأطفال لهم حقوق، ومن أهم حق من حقوق الأطفال إنه لما يتكلم نسمع له ونحاول إن إحنا نحقق رغباته، وإن كان مش هنقدر نحقق رغباته لازم نشرح له ليه إحنا مش قادرين نحقق رغباته. الأمم المتحدة دورها مهم جدا جدا، مؤسسات المجتمع المدني مهمة جدا جدا جدا. معنا السفيرة نبيلة مكرم عبيد وهتتكلم أكيد على الcivil society, the role of the civil society in promoting the right to mental health. The right to health has two components: the right to enjoy the best possible state of health and the right to access the best possible health services. في النهاية I would like to thank our panels and thank you for your patience, and I think we're good with time. شكراً.